How long does it take for Cymbalta to work? Imagine that you are one of the millions of Americans who suffer from common mental and physical conditions such as major depressive disorder, MDD, generalized anxiety disorder, GAD, fibromyalgia, or diabetic neuropathy. You may be surprised to learn that Cymbalta can provide relief for all your symptoms. Cymbalta can be used safely to treat a variety of mental and physical health conditions. But how long does it take for Cymbalta to start working? What is Cymbalta? Cymbalta, also sold under the generic name duloxetine hydrochloride, is a prescription medication that belongs to a class of drugs called selective serotonin-noredrenaline reuptake inhibitor antidepressants, SNRIS. SNRIS are used to treat anxiety and depression. Cymbalta was approved by the U.S. Food and Drug Administration in August 2004 for the treatment of depression. It quickly rose to be one of the most prescribed antidepressants in America. Cymbalta was the 46th most prescribed drug in America in 2017, with an estimated 16.5 million prescriptions. What are the uses of Cymbalta? Cymbalta can be used to treat major depression and other mental and physical health conditions such as generalized anxiety disorder, GAD, in children aged at least 7 years, diabetic neuropathy, and fibromyalgia. Below is a brief description of each condition and its associated symptoms. Major depressive disorder / clinical depression. Major depression, also known as clinical depression, is a mental illness that causes intense, persistent sadness for up to 2 weeks. This condition can affect all aspects of a person's life, including sleep patterns, mood, and behavior. Major depressive disorder patients often lose interest in hobbies and activities, have difficulty with daily tasks, or experience suicidal thoughts and behaviors. These symptoms are often associated with major depressive disorder. Low concentration and difficulty concentrating. Mood swings. Nervous energy. Feelings of being in slow motion or moving around. Eating and sleeping more than normal. Feeling empty, sad, or tearful. You have lost interest in the activities that you used to enjoy. Suicidal thoughts and behaviors. Feelings that you are worthless, guilty, hopeless, or helpless. Generalized anxiety disorder. GAD is the most common form of anxiety disorder. It often has no apparent cause. A panic attack is a common symptom of generalized anxiety disorder. It can cause an increase in heart rate, difficulty concentrating, rapid breathing, and restlessness. An anxiety attack, also known as a panic attack, is a more severe form of anxiety. It can cause dry mouth, dizziness, anxiety attacks, anxiety, shortness of breath, and sweating. Fibromyalgia. Fibromyalgia can be described as a chronic, undiagnosed musculoskeletal condition that affects all parts of the body. The condition can cause chronic musculoskeletal and mood problems, fatigue, tension headaches, TMJ, disorders as well as sleep issues, memory issues, IBS, anxiety, depression, and sleep issues. Fibromyalgia may be caused by the brain's inability to process pain signals properly, which can cause painful sensations to be amplified. Cymbalta can also be prescribed by the FDA for chronic pain conditions such as back pain and diabetic peripheral neuropathy. Diabetic neuropathy. Diabetic peripheral neuropathy can be a side effect of diabetes. It is caused by high blood sugar levels. Diabetes can cause nerve damage, especially in the feet and legs, when blood sugar levels are too high. Diabetic neuropathy symptoms can include problems with blood vessels and the heart, pain in the legs and feet, digestive problems, or problems with the urinary tract. Talk to your healthcare provider before you start Cymbalta. This is especially important if you are breastfeeding, as it can enter breast milk, narrow angle, glaucoma, and have had a history of liver damage, liver problems, or liver injury. How long does it take for Cymbalta to work? Cymbalta is not an antidepressant and SNRI. It does not work instantly. The drug takes time to start to alter the brain's chemical imbalance. Within 1 to 2 weeks, You may notice a change in your sleep, energy, and appetite. Sometimes, it may take up to 6 to 8 months for a complete improvement in depression and increased interest in activities to be noticed. What is the cost of Cymbalta? Cymbalta is the brand name medication. However, duloxetine is also available generically. This is significantly cheaper than Cymbalta. Some commercial insurance plans may cover Cymbalta, while Medicare and Medicaid may not. However, nearly all plans will cover the generic version. It is possible to get both generic and brand name versions of the drug for a lower price using a pharmacy discount card, regardless of your insurance status. Below is a table that compares the cost of a 30-day supply of Cymbalta or duloxetine.